If there's one mineral that most older adults are not getting enough of, and that most doctors don't routinely check for, it's magnesium. Magnesium is involved in over 300 enzymatic reactions in the body. It affects energy production, muscle and nerve function, blood pressure regulation, blood sugar control, protein synthesis, and the structural development of bone. It is also required to activate vitamin D, meaning that even if you're taking vitamin D supplements, deficiency in magnesium can prevent it from working properly. Yet surveys consistently show that most adults over 60 do not meet the recommended daily intake, and conventional blood tests often miss the deficiency because only about 1% of the body's magnesium is in the blood. Today we're covering why this matters and what to do about it. Let's be specific about what magnesium actually does because the range is remarkable. Muscle function. Magnesium regulates muscle contraction and relaxation. Without adequate magnesium, muscles can't fully relax. This manifests as muscle cramps, tightness, restless legs, and eye twitches. Heart rhythm. The heart is a muscle, and magnesium is critical to maintaining normal heart rhythm. Deficiency is associated with arrhythmias, palpitations, and elevated blood pressure. Blood pressure. Magnesium relaxes blood vessel walls, directly reducing blood pressure. Multiple studies confirm that supplementing magnesium modestly but consistently lowers blood pressure in people who are deficient. Blood sugar and insulin. Magnesium is required for insulin receptors to function properly. Deficiency impairs insulin sensitivity and is strongly associated with type 2 diabetes. A large meta-analysis found that each 100 milligram increase in daily magnesium intake was associated with a 15% reduced risk of developing type 2 diabetes. Bone health. Approximately 60% of the body's magnesium is stored in bone. Magnesium is required for calcium metabolism and bone crystal formation. Deficiency directly weakens bones. Sleep. Magnesium regulates GABA, a neurotransmitter that promotes relaxation and sleep. Low magnesium is associated with poor sleep quality and insomnia. Energy. Magnesium is essential for ATP synthesis, the process by which your cells generate energy. Deficiency causes the persistent, unexplained fatigue that many older adults experience. Mental health. Magnesium regulates the stress response and has been shown in clinical trials to reduce symptoms of depression and anxiety. Older adults are at disproportionate risk of magnesium deficiency for several compounding reasons. Dietary intake declines with age, smaller appetites, fewer calories consumed, and a tendency to eat fewer magnesium-rich foods like nuts, seeds, and leafy greens. Absorption decreases with age. The small intestine becomes less efficient at absorbing magnesium over time. The kidneys excrete more magnesium with age and when under stress. Many medications that are commonly prescribed to older adults deplete magnesium. Proton pump inhibitors, the acid reflux drugs like omeprazole, are the most significant. Studies show they can reduce magnesium absorption by up to 30%. Diuretics, commonly prescribed for blood pressure and heart conditions, cause magnesium to be excreted in urine. Certain diabetes medications and antibiotics also deplete magnesium. Excess alcohol significantly increases magnesium excretion. The combination of reduced intake, reduced absorption, increased loss, and medication depletion means that many older adults are running chronically low and most never know it. Because magnesium is involved in so many systems, its deficiency produces a wide range of symptoms, most of which are frequently attributed to other causes. Muscle cramps and spasms, particularly leg cramps at night, are among the most common and recognizable symptoms. Sleep problems, difficulty falling asleep, staying asleep, or waking unrefreshed. Fatigue and weakness, persistent low energy despite adequate sleep. Anxiety, irritability, and low mood. Magnesium deficiency activates the stress response and depletes calming neurotransmitters. Palpitations or irregular heartbeat. Constipation. Magnesium relaxes the muscles of the intestinal wall. High blood pressure that's difficult to control. Headaches and migraines. Magnesium deficiency is one of the most well-supported triggers of migraine. Tingling or numbness due to impaired nerve function. If several of these sound familiar, it's worth discussing magnesium levels with your doctor and considering supplementation. The best dietary sources of magnesium are dark leafy greens, particularly spinach, Swiss chard, and kale. 1 cup of cooked spinach provides about 150 milligrams. Nuts and seeds, pumpkin seeds are the richest source at 156 milligrams per ounce. Almonds, cashews, and Brazil nuts are also excellent. Legumes, black beans, kidney beans, lentils, and chickpeas provide 60 to 120 milligrams per cooked cup. Whole grains, brown rice, oats, and quinoa contribute meaningfully. Dark chocolate, at least 70% cocoa, provides about 65 milligrams per ounce and is a genuinely healthy treat in moderation. Avocado and banana are good everyday sources. Fatty fish, salmon, and mackerel contain moderate amounts. For many older adults, diet alone may not be sufficient to maintain optimal levels, particularly those on magnesium-depleting medications. Supplementation is safe, inexpensive, and effective. The RDA for magnesium is 420 milligrams for men over 50 and 320 milligrams for women over 50. Most diets provide only 200 to 250 milligrams. The form matters significantly. Different magnesium compounds have very different absorption and side effects. Magnesium glycinate, the most bioavailable form with the fewest side effects. Excellent for sleep, anxiety, and muscle cramps. The recommended choice for most people. Magnesium citrate, well-absorbed and effective, has a mild laxative effect at higher doses, useful for constipation. Magnesium malate, good absorption, particularly useful for muscle fatigue and energy. Magnesium oxide, the cheapest form but poorly absorbed, not recommended. Start with 200 milligrams at bedtime. Magnesium's relaxing effect makes evening the ideal time. Build up gradually as needed. Magnesium is arguably the most underappreciated mineral in senior health. The symptoms of deficiency are widespread, the causes in older adults are multiple and compounding, and the fix is simple and inexpensive. If you experience muscle cramps, poor sleep, fatigue, anxiety, or high blood pressure, and particularly if you take a proton pump inhibitor or a diuretic, magnesium deficiency deserves serious consideration. Ask your doctor about testing and consider starting a magnesium glycinate supplement at a low dose to see how you respond. As always, check for interactions with your current medications before starting any new supplement. See you in the next video.